we're taking your calls for Dr. Zorba Paster, 270-9933, the number to call.
And it's a great night to call in if you have a question. There's 3 lines open if you have a question for Dr. Paster.
And we'll start with Angie in Jefferson. Hi, Angie, go ahead.
Hi. I take pravastatin, have for probably about 5 or 6 years now, but all my cholesterol levels are within range. So is that something that I should talk to the doctor about maybe not having to take it, or?
Well, it rather depends. In other words, if you're at risk, if you have high blood pressure, history of heart disease in the past, family history, we know that statins do more than just lower the cholesterol, because other drugs that lower the cholesterol do not reduce the risk of heart attack. So we know that statins in and of themselves do something else. They stabilize the plaque, which is on your coronary arteries, and the plaque that's also in your brain. So they have secondary effects that are really, really important. And we now know that because many of people still have elevated triglycerides, that fish and fish oil can really make a difference. So this is something where you need some individual, really, discussion with your doctor to come up whether or not that's the right drug for you.
All right, and any fish?
Well, any fish is good. It turns out fatty fish is the best. So salmon is a very good idea of a fatty fish. And believe it or not, sardines. Now, I happen to love sardines, but when I open up a can of sardines, my wife, Penny, doesn't really like the smell of sardines. You know, they have a distinct smell to them. But the fattier the fish, the better off it is. So it turns out salmon is better than cod, and sardine, for instance, is an inexpensive, very, very good fish that really does a great job at lowering triglycerides.
All right, fantastic. Let's go to Robert in Janesville. Hi, Robert. What's your question?
Robert, you there? Hello, Robert? Nope, he's gone.
Oh, okay.
He was asking about vitamin D level. I'm not sure what.
Well, vitamin D, we know that many people are low on vitamin D, especially during the wintertime. And so taking 1,000 or 2,000 milligrams of vitamin D3, and frankly, D3 is the only thing I think that's pretty much sold in the country, can make a difference. And of all of the vitamins and minerals that I've ever talked about, vitamin D3 still is standing the test of time. So I recommend people take 2,000 international units of vitamin D3 really year-round, because we don't really get a lot of sun in Wisconsin. We think we get a lot of sun. Maybe we do in July and August, but the rest of the year, come on, we don't really get as much sun as we'd like to have. So 2,000 units of D3 can really make a difference, I think, overall. And of course, anyone with osteoporosis or risk should definitely be on that vitamin.
All right. Let's go to Beth now in Mount Horeb. Hi, Beth. What's your question?
Hi, I got my first booster shot in December. When can I get the second booster shot?
Anytime you can make an appointment. I think it's a good idea. I just got my second booster shot 2 days ago. No reaction at all. My wife got her second booster shot yesterday. Once again, this is science and evolution, folks. So the answer is right now, it appears that maybe we need a second booster. Maybe we need one every year. We don't really know. But right now, anyone over the age of 50, or rather over the age of 65, or anyone over the age of 50 who has a medical problem, it's recommended they get a booster. I'm not sure exactly if it's 6 months after the last booster.
It's 4 months. It's 4 months.
Okay. 4 months.
People 50 and over.
50 and over. So
4 months after
recognition, 50 and over. And that's what they really came up with. Once again, this is something in evolution, and you can always go to the CDC website. But we know now you can call up your local clinic and see when you can go in to actually get a shot. And once again, you might as well get it, because the more protected you are, the less likely you are actually to get COVID or to get a serious case.
And you can get either one. You can get Moderna or Pfizer. You don't have to stick with what you have. Either one, mix or match,
doesn't make a difference. Either one of those really can work out.
We are out of time, unfortunately. Thank you all for calling in. We'll do this again in a couple of weeks.
Thank you, Zorba. We'll see you soon.